Have you ever seen a message pop up and your stomach drops? Or you get a call and your chest tightens? You haven't even spoken yet, but your body already knows. That's not being dramatic. That's a boundary alarm. Your body knows. Welcome to Holistic Mental Health, nurturing mind, body, and soul. I'm Olive. This is your weekly space for practical tools that support your well-being. Each week, we explore one topic with simple skills you can use in real life, calmly, clearly, and consistently. Today, we're continuing our Boundaries series, and today's lesson is simple. Your body often notices a boundary problem before your mind admits it. Quick note before we begin. This podcast is education and support. It's not therapy or medical advice. If you're in immediate danger or crisis, please contact local emergency support where you are. All right, take a breath in and out. Let's get into the heart of it. What is a boundary alarm? A boundary alarm is your internal signal that something is too much, too close, too fast, too demanding, or simply not safe for your nervous system. And boundary alarms can show up as tightness, dread, irritation, shutdown, people-pleasing, over-explaining. Sometimes you don't even have words. You just feel off. And that off feeling matters. Why your body reacts first. Your brain is a meaning maker. It tries to be polite, logical. It tries to keep the relationship. But your body is a truth teller. It tracks safety and stress in real time. So if you've learned to ignore your needs, your body becomes the messenger you can't ignore anymore. This isn't a weakness. It's intelligence. Let's name common boundary alarms. You might recognize one. Jaw clenched, shoulders up to your ears, a tight chest, a heavy stomach, a throat that closes when you want to speak. Or the opposite. You go numb, you disconnect, you scroll, you forget to reply, you disappear. That's not laziness. That's your system trying to protect you. Emotional signals. Feelings are data. Now the emotional alarms. These are the feelings that show up after interactions. Resentment, dread, irritation, anxiety, guilt. That feeling that you owe someone, even when you don't. If you often feel those emotions around the same person or situation, that's not random. That's a pattern. And patterns point to boundaries. 3 types of people who trigger boundary alarms. Let's make this practical. There are a few common patterns that trigger boundary alarms. Type 1. The urgent requester. Everything is right now. Everything is quick. And somehow, their emergency becomes your responsibility. Your body might react with pressure, rushing thoughts, tight chest. Reframe this. Urgency is not the same as importance. Try this script. I can't do this right now. I can look at it at, or, I'm not available today. I can support you on. Type 2. The guilt tripper. They hint, they sigh. They make you feel wrong for having limits. Your body might respond with shame, a stomach drop, the urge to over-explain. Try this script. I hear you, and my answer is still no. Or, I understand you're disappointed. I'm still not available. Then pause. No long defense, just steady. Type 3. The boundary tester. They treat your limit like it's flexible. They search for the loophole. This is where consistency matters. Try, I've answered this already. My answer hasn't changed. Or, if you keep asking, I'm going to end the conversation. And if it continues, follow through calmly. That's how your nervous system learns, I protect myself now. So if your body reacts, it may be responding to a pattern you've lived through before. Naming the pattern gives you power. And power doesn't need to be loud. It just needs to be consistent. The after test. Here's a fast boundary detector. We call it the after test. After spending time with them, do you feel more like yourself or less like yourself? After saying yes, do you feel steady or do you feel trapped? After that conversation, do you feel clearer or confused and tense? Your after matters. Why people ignore alarms. Many of us were trained to ignore these alarms. So when our body says no, our mouth says, sure. If that's you, you're not broken. You're unlearning a pattern. Transition to guided practice. Okay, let's do a short practice together. You don't need to be perfect, just present. If you can, place one hand on your chest or on your stomach. Let's listen in. Guided body scan. Take a slow breath in and out. Think of a situation that drains you. Not the most traumatic one, just a common one. Picture it for a moment. Now ask, where do I feel it in my body? Jaw, chest, stomach, shoulders, throat? No judgment, just noticing. Now breathe out and soften one area by 2%. Just 2%. Good. Name it, need it, next step. Now we do a simple 3-step method. Name it, need it, next step. Name it. What's happening? Example, I feel pressured. Need it. What do I need? Example, I need time. Next step, what will I do? Example, I'll respond tomorrow. This turns anxiety into clarity. Boundaries are actions, not speeches. Here's the key point. Boundaries are not long speeches. They are small, repeatable actions. Your nervous system trusts what you repeat, not what you promise once. So your goal this week is to become consistent, calm, clear, steady. What to say? Scripts. Let's practice a few scripts. Say them out loud if you can. Here we go. I'm not comfortable with that. No, thank you. I need time to think. I'll get back to you. I'm not available for that. If this continues, I'm going to step away. Short, simple, no debate. Role play 3. Real scenarios. Now let's role play 3 common situations. We'll give you a calm script and the follow-through. Let's go. Scenario 1. Late night texts. It's late. You're resting. Script. I don't respond to messages after 8 p.m. I'll reply tomorrow. If they push, I understand. I'll respond in the morning. Follow-through. You stop replying. You sleep. You answer tomorrow. That's the boundary, not the speech. Scenario 2. Disrespectful tone. Someone talks down to you. Script. I'm willing to talk when we're respectful. If it continues, I'm ending this conversation now. Follow-through. You hang up or step away or change rooms. You don't stay to prove your point. You leave to protect your peace. Scenario 3. Last-minute demands. Someone asks for something big. Script. I can't do that today. The earliest I can do is, or, I can do X by Friday or Y by Wednesday. Which matters most? If they guilt trip, I hear you. I still can't do it today. Follow through. You don't rush. You don't panic prove. You stick to the time you offered. If you felt discomfort hearing those scripts, that's normal. Boundaries aren't about being harsh. They're about being clear. And clarity is kindness, especially to you. Pushback warning. One more thing. When you start honoring your alarms, some people will push back. Pushback doesn't mean you're wrong. It often means you're changing the pattern. Stay calm. Repeat the boundary. Follow through. Reflection. Weekly assignment. Your reflection question. What does your body do when you cross your own boundary? And your weekly assignment. Choose one small boundary alarm, just one, and respond with one small boundary action. Small is powerful when it's consistent. If this episode helped you, save it and share it with someone who's learning to protect their peace. Next week, we're talking about the pause and how to stop auto yes. Because your yes should be a choice, not a reflex. See you next week.